Hello, my name's Clint Flanagan. I'm a family medicine physician working in Colorado, and I am founder and CEO of NextEra Healthcare. So before direct primary care, I had done my residency in Colorado and came out of residency and joined a larger multi-specialty group where all 50 doctors or so were partners, and I did that for a number of years. Great group of docs and learned a lot. Got to a point where I was thinking about other options, and so in that case I went ahead and joined Colorado's largest provider of healthcare and worked for them to help set up clinics in Colorado, mainly in the Denver area. Down that pathway, where I eventually landed was owning my own medical center. So I felt that perhaps I could have more administrative and organizational control by owning medical centers, and through that process figured out that one of the main challenges with primary care in this country is the payment model. And so this is back in around 2009 or so when our team said, gosh, we need to do something different than this existing fee-for-service insurance model. So that's what led us to, technically at the time we called it monthly membership medicine because we really didn't know what direct primary care was. Over time we found some friends like Dr. Garrison Bliss, and he was calling what he did direct primary care, so we started calling what we were doing direct primary care. While I was doing family medicine, I was also working in the emergency room, and I spent about 15 years working in a variety of different ERs across Colorado. So I kind of had the lens of both an ER physician as well as a family medicine physician. And what I saw a lot of in the ER is just people that didn't have a family medicine physician or primary care provider. And they were seeing the ER team to help them with their ailment, and gosh, more than half the time it was not an emergency. And coupling that with the experiences that I'd had as a primary care physician in the traditional model really put us in a place where we said we need to have a different model, a different business model, a different care model for primary care. And so we pioneered that in Colorado and started charging a monthly membership to individuals and families. Being huge fans of small business, we also targeted our friends or patients that owned plumbing companies or electrical companies or HVAC companies, and started providing care for employer groups as well. We're able to do a lot more in a lot more efficient way and a lot more affordable way. So I'll give you an example. The traditional fee-for-service primary care system typically is built on seeing the patient face-to-face, and that's a little bit old school. You know, more than probably 50 to 70% of what we do for patients can be done virtually. So at NextEra Healthcare, our company, we use 21st century technology to take care of patients. So that means our patients can call us, they can text us, they can email, they can fill out assessments about their cough and cold and rash and send those things our way. They have a direct relationship with their physician that is not, let's say, burdened by the tremendous administrative hassles that nearly all fee-for-service primary care providers feel. So, and it's not, again, that fee-for-service primary care physicians are delivering bad care, right? It's just based upon a fee-for-service administrative billing model that is really outdated and clunky, and so all of us in DPC, we kind of kick that to the can and we bill our patients directly monthly. And for that one monthly bill, which many describe as a gym membership, patients have unlimited care. So family members, husbands, wives, kids, etc., can see their physician and do so without a copay, without a bill. So imagine if you're watching this and you're wondering about, gosh, what kind of relationship could I have with my doctor, or I don't have a relationship with my doctor, or gosh, it's super expensive, or gosh, I have this high deductible insurance vehicle and I only get one visit a year with my doctor. You know, contrast that with direct primary care, where we take care of you literally every day of the year. What that allows for compared to fee-for-service medicine is allows for us physicians to be very proactive and preventative. Many of us went into healthcare so we could help not only obviously with sickness, but actually be proactive and help people get healthier. We love that lane in direct primary care. And again, if you think of it kind of like a gym membership, what we tell our patients is, you know, if you only go to the gym once a year, you're probably not going to move the dial on your own health and wellness. How about being able to go as often as you want and not only have face-to-face visits, but get some virtual coaching as well. So we're happy to be our patient's health coach and provide a level of service that you just don't see in fee-for-service medicine. The other thing I would mention is ancillary services and all the things we write for as doctors. So we write prescriptions, we write orders for x-rays, we write referrals for behavioral health, orthopedics, vasectomies, etc. Right? What you'll see in DPC is we really try to be in tune with the cost of the things that we are writing for or we're ordering. Many of us have in-house pharmacy, and we can buy medicines near wholesale and get them to patients. We have relationships with our specialty colleagues where you get discounted treadmills and discounted MRIs and CT scans. And so we really are not only there to provide tremendous care for patients, but also there to help guide them and really be cognizant of their pocketbooks, or what we like to say is be good stewards of our patients' pocketbooks. So a lot of value for a monthly membership that's typically less than what a Starbucks coffee costs a day. Much different than what I used to do in fee-for-service medicine, which was see 25 to 35 patients a day, and a third of that day was also spent coding and billing, and many of us call it pecking for payment on my computer, and that takes away time from the patient, which is the most important thing. So I guess the last statement on that is DPC allows for a patient-physician relationship that it's truthfully not innovative at all in that circumstance, because what we're doing is restoring the doctor-patient relationship, something that some of us grew up with in small-town Nebraska. Yeah, so for physicians or providers interested in direct primary care, people are like, gosh, it's going to be such a risk. The greatest risk is staying in the status quo. That is the greatest risk. And I would highly encourage you to take a look at direct primary care, and specifically the Direct Primary Care Alliance is a tremendous resource of physicians that have just a lot of knowledge, but not knowledge that they're willing to share to help you along. Back when we started back in Colorado in '09, there wasn't a cadre of people. We were just creating our own playbook, and now fortunately there are many DPC physicians and providers across the country that are more than willing to be helpful. At NextEra Healthcare, our company, we have residents rotate through, we have medical students rotate through. We're always happy to be a resource. We have a program now where we have a NextEra Healthcare community, and we have close to 80 locations across the country serving employers and employers and patients all throughout the country. So happy to help talk to you about the business side of DPC, as well as obviously the care side, which is the most important thing.